I just got back from another successful visit to a periodontal office here in the States. I seldom go to other perio offices just to kind of be another fresh set of eyes. I've been working at my periodontal office for 21 years. I started out as a surgical assistant. I have been a treatment coordinator. I've worked front desk. I've done every aspect of my office. So when I go to other perio offices, what I do is I just observe what they do, how they schedule, answer the phones, present plans, do new patient examinations, mingle with their patients, how do they get along together, and I try to find ways that they can work smarter, not harder, improve some structures, implement some new structures and ideas, because in your office, all you know is what's within your own four walls. You always practice the same, you've always done the same, you polished and improved things that you're already doing, but you don't know anything new unless someone comes in and shares the ideas, or you go somewhere else and you see what they do. So we do have offices come to our office to watch what we do. They take some nice gems, they take it back to their office, and they have some new great ideas. But I go to perio offices and I, for the first day, will just observe. I'll watch what staff is doing. I will take notes. I'll probably help them throughout that day with some ideas. Hey, try this, or have you ever tried this? And then on the next day, we sit down for the whole day and I go over what I saw, what I would change, what I would improve, and we just kind of work on those together, and I work on how to implement it into your practice. So I just got back from one in California. Love that office. It's a very large 3-doctor perio office. They already have a lot of wins within their own practice, some good staff, but we were able to put in something new, and actually it's something I put into a lot of offices because I have found that it's something that works against them. So we used to, a long time ago in our office, we had assistants see new patients, and they were also the same person that presented the case to the patient. It's great. If you have the staff to do it, it works beautifully. Why? Because one, your assistant is so knowledgeable on everything that you do. They do the surgeries with you, they see the before, they see what happens in surgery, they see the healing, they see the results afterwards, they know exactly what's going to happen, they can prepare your patient for it. They know the value, they can stress that to your patients. They can answer any questions. They can already do the pre and post-op. They can schedule. They know how to schedule your surgical schedule. They know everything. So teaching them how to present a plan, collect money, put in financing, 5 minutes care credit, cherry on the computer, it's not much at all. We've always done that, and it's always really helped us. Times changed, we had to switch things around, so we now have, like almost everybody else does, we have an assistant that sees the patient and then they hand off to a treatment coordinator. However, we never went away from an assistant presenting the plan, because you do and you can have some pretty skilled front desk people that can present, but I would bet money on it that they can't present like an assistant can present, because the confidence level, the knowledge level, it's there, and that value sells. As an assistant, we are very passionate about the treatment because we know the treatment. We can use models and photos and x-rays and perio charting. Unlike a front desk person, we can use that to a different level of really explaining to you why you have the bone loss, the disease, everything going on. We can explain it. So I do strongly recommend that you train your assistants to take the patient from that room, get him out of the room, because chair time is money. You don't want him sitting in the room. Take him to a consult room and start to go over the plan. Now, if you still want your front desk people to be the treatment coordinator, then do this. And this is what I've been doing in most of these offices when I go. What you do is, when you're getting done with that examination, before you sit that patient up, you have your assistant call on the treatment coordinator, because when the patient sits up, you want them to see this treatment coordinator in your room, and you want to introduce your treatment coordinator. This is Julie, my treatment coordinator. She's going to be here to take some notes so she can present some options to you. And then the doctor will start to talk to the treatment coordinator. Julie, today, John comes in and here's what we found. He's got an infection in his tooth, and, there's nothing we can do to save this tooth. It's going to have to go. So I'm going to extract this tooth and do a bone graft, and then we're going to wait a few months, and then I'm going to put in an implant, and then Dr. Lewis is going to restore that implant with a custom abutment and a crown, or if John doesn't want to do an implant, which I think is the best option for him, we could do this or we could do that, and you go over your options. So Julie's taking down the notes, and Julie's going to be talking to you about that. She's going to say, how many units for that extraction, if she needs to know how much time or money. Would you like some Mineros or any other materials with that? Do you want to use some PRF? And you can say things like, how soon should this tooth, come out? Is this something that should be done like yesterday, or can we wait a few weeks? And that way you can discuss the urgencies. You can say something like, what would happen if John doesn't replace this tooth with an implant? Now, we ask pretty dumb questions in that room. It's not for me. I know exactly why. It's for the patient. And we do this so the patient can have a better understanding of why an implant needs to be placed. So Dr. Sheldon might say, he really does need to replace that tooth. It's a very important tooth in John's mouth. And if he doesn't replace it, the other teeth are going to start to get tired and get beat up because they're taking on all these forces. Or that upper tooth might start to grow down because there's nothing there to keep it in place. Or the other teeth might start to shift. So there's a lot of things we can discuss there. If it's a perio case and the teeth are mobile, I can say, why are the teeth so loose? And I change the word from mobility to loose because I want the patient to really understand. Why is this patient losing so much bone? I ask these questions because when I'm in there with the patient, I can read the patient pretty good, and I can see when they're really paying attention and when they're losing interest or they don't really understand something. So as the patient advocate, this is for your assistant and for your treatment coordinator. As the patient's advocate, have them watch that patient and read that patient and see when there's something they might need to ask to regain the interest and get them really connected with the conversation, understand why they need to have some, scaling and root planing. Why do they need to have perio surgery? Why do these teeth need to come out? Why do they need that tissue grafting? Because in perio, unfortunately, most of the plans that you're planning is not symptomatic. They're not coming in with a really bad toothache. They might come in because they want some cosmetic or chewing, improvements. But in perio, we don't have patients coming in, just with all this pain, or a lot of it is because we're trying to keep them from losing their teeth in the future. And if they have symptoms, it's too late or very expensive. So you need to have your treatment coordinator in that room before you set the patient up so she can be a part of the entire presentation, the entire discussion as to why. You want her to hear the patient's maybe reasons why they don't want to do anything, apprehensions, or maybe their disbeliefs or their confusions. You want to hear the doctor talking about the abscesses, the bone loss, the thin tissue, what's going to happen, because that treatment coordinator needs to know all that when they go into the room together with the patient. And the patient starts to back out, like, maybe I'll wait till next year. They need to know these reasons, or all they have to say is, all right, well then just give us a call if you have any questions, because they don't know, they weren't in the room. So you either have to have the assistant in there from start to finish and present, or the treatment coordinator in there, and don't let them leave too early. Have them really be in there until the patient is done asking questions, the doctor is done explaining. Then they can go and work that plan up while the assistant continues to talk about pre and post-op. And you want them to do that because it's keep moving forward with acceptance. So as the treatment coordinator leaves and the doctor leaves, the assistant can say, okay, we're going to go over a little pre and post-op instructions for how to prepare for this procedure. What we're going to do is called scaling and root planing. This is how we do it. It's going to take about this long in the room. This is how you prepare before. This is how you're going to feel after. And they keep talking because that's going to tell the patient, okay, we're proceeding, we're going forward with treatment. You're going to accept, you're going to have this done. This is why you're going to have it done. And your assistant's great with that because they know all that information. The treatment coordinator goes, puts together the plan, gets it all printed out, and then gets the patient, brings them to the consultation room. Always have models to show. There's a wonderful periodontal model that shows one side healthy, one side is disturbed. So those are great to have. Have those in there. Print out the pictures. Have them on the table for the patient to see and look at. Print out the x-rays. Show the little calculus barnacles on the roots of the teeth. Show the bone loss in there. Show the missing teeth in there. Have all this on the table and put it in the folder with the plan for them to take home with them. You want them to have this information because when they go home, guess what? Husband's going to ask, why did you spend $5,000 on this? Why did you spend this money? And they need to have all that there to show them. I put in implant brochures, recession brochures, periodontal brochures. I put in their treatment plan. I put in the x-rays, the photos. I put in the perio charting with the red numbers on it. I put all that in there. Plus we have some other documents I can share with you if you're interested. Reasons to choose us other than any other offices, why choosing a specialist is better, all these things that you can put in there for them to look at as they're mulling it over to confirm why they're doing this. So when the patient is being brought back to the consultation room, they already know Julie. They already know Julie knows everything. Julie has everything printed out. She knows the reasons, and she can continue to guide the patient to acceptance, knowing the reasons why. They have to have all this information, or all they're doing is pushing a piece of paper with a number on it, and that's it. So do this one thing. Try it for a week. Try to see, one, maybe your assistants can start presenting. You can even use your front desk, who already knows how to put in plans, to put the plan in, bring it back to the assistant, hand it to them, and then let them continue. Or do as you're doing, have your front desk treatment coordinator do the presenting, but continue to use your assistant to discuss treatment. Ask the questions when you're gone so you can move to the next patient. They can do pre and post-op. They can answer those questions, and have your treatment coordinator in that room before the patient even sits up. You can use the Blue Note, you can use the walkies, your intercommunication on your computer to get that treatment coordinator in that room before they sit up so that they're part of that whole equation. If you have any questions on this, or you don't quite know how to implement this with your team or your office, you can always, as a member, you have unlimited email. You also have a 30-minute call you can do with me a month. You can click on the link for to schedule on my calendar. We'll do a 30-minute call. I can explain to you how we do it in our office. I can explain how you can do it in your office, and we can get your treatment coordinators getting more acceptance for your cases. If you want me to come into your office and see how I can do things, how I can show your staff and you how to do things better, more successful, same thing. Click the link below, have me do a 30-minute conference call with you. We can discuss this and other things that I can do for your office. You guys have a great day. Thank you.